Now I want to talk about another medical procedure, and okay, talk about how it's done, talk about its advantages and all of that. So this is what is known as a colpotomy. When you hear them talking about colpotomy, what do they mean by that? Okay, so it's just a surgical procedure, and it involves incision into the vaginal wall. So any surgical procedure that you have to actually incise into the vaginal wall is what is known as colpotomy. So it's typically performed to access pelvic organs such as uterus. So you want to actually go through the uterus, okay? You want to go to the fallopian tubes, you want to go to the ovaries. So instead of accessing it through the stomach, you access it through the down part, which is the vagina. So that's colpotomy. So uses gynecological surgical access, okay, enables entry into the pelvic cavity, okay, for procedures like tubal sterilization as well as tubal ligation, okay, a mode of contraceptives, permanent contraceptions. Sometimes you might be going through the vagina, incising through the vagina because you want to go and remove fibroids. Then Culdoscopy is a colpotomy, may be used to insert a Culdoscope, okay, for visualizing pelvic structures. Then natural orifice surgery. So posterior colpotomy is often prepared for accessing the rectal uterine pouch. So sometimes you want to do some procedures on the urinary system. Okay, so you actually just go through the vagina, instead of going through the stomach, which will be so much work. So types, you have anterior colpotomy, which is incision on the up part. Posterior colpotomy is incision in the back part. So every surgery actually carries a risk. So there's risk for bleeding, infection, pain, So all of that might be possible risks, right? Just as a mode of introduction, that's just what colpotomy means, in case you see the word colpotomy anywhere.